Hello everyone. In this video, we will talk about the mechanisms of actions of various antibacterials and the sites that they act on in the bacterial cell. So if we assume that this is the bacterial cell, this outermost layer is the cell wall, this is the cell membrane, this is the DNA of the bacteria, and this is the RNA with the ribosomes, the 50th ribosome and the 30th ribosome. Now let's one by one discuss the various antibacterials which will act on the various regions. The first ones are cell wall synthesis inhibitors. These include beta-lactams, which will include penicillins, cephalosporins, carbapenems and monobactams. The second group is glycopeptides, in which vancomycin is included. The third drug is bacitracin, and the fourth example is phosphomycin. So all these will act on the cell wall of the bacteria and they will inhibit the cell wall synthesis. The same function of inhibition of cell wall is done in tubercular bacteria by isoniazid, pyrazinamide and ethambutol, which are the first line drugs in tuberculosis. If we come to folate mechanism, PABA enters the bacterial cell and forms dihydrofolate, which forms tetrahydrofolate, and this gets incorporated into the DNA. This mechanism will be inhibited by two drugs, sulfonamides and trimethoprim. Sulfonamides will inhibit the conversion from PABA to DHF, and trimethoprim will inhibit the conversion from DHF to THF. Individually, these two are bacteriostatic drugs. They will only stop the further growth of the bacteria. But when they are combined, they become bactericidal, which means they will completely destroy or kill the bacteria. The next group of drugs are protein synthesis inhibitors. They will inhibit bacterial protein synthesis by either inhibiting the 30th ribosome or the 50th ribosome. Drugs inhibiting the 30th ribosomes are aminoglycosides and tetracyclines, and drugs inhibiting 50th ribosomes are macrolides, chloramphenicol, lincosamides and clindamycin. The next group of drugs include RNA polymerase inhibitors. They will inhibit the DNA-dependent RNA polymerase in the bacterial cell and they will prevent the formation of the mRNA in the bacterial cell. This will include drugs like rifampicin as well as fidaxomicin. The next group of drugs are DNA gyrase inhibitors. DNA gyrase inhibitors include quinolones. Finally, cell membrane inhibitors like polymyxins and lipopeptides will inhibit the formation of the cell membrane in the bacteria.